OB hospitalists have been around, for multiple decades now and are found all across the country. Essentially, they're OBGYNs and or certified nurse midwives whose primary responsibility is to take care of patients who are physically in the hospital. So that could mean emergent visits, like if a patient comes and is complaining of, some issue during their pregnancy, it could be the OB hospitalist that sees them, like a lot like an ER physician, but for pregnant patients. Additionally, OB hospitalists take care of patients in labor or antepartum as well. And we could be the primary provider for those patients during their labor, especially if they maybe don't have a physician that goes to that facility, or they don't have a primary provider who does deliveries. Additionally, though, sometimes our community physicians and midwives ask us as OB hospitalists to help them manage their patients. So they may turn over their patients' care to the OB hospitalist for any certain time period. It could be a night, it could be a day, it could be, whatever really makes sense and works for them. So the goal of the OB hospitalist is really to work collaboratively within that community to meet the community's needs. And the community obviously includes the existing physicians and midwives that practice there. Yeah, absolutely. So since the OB hospitalist team, whether it's just the physician or it's physician plus certified nurse midwives, are physically in the hospital 24/7, they have the ability to really collaborate with the hospital setting to work on quality improvement. And so unlike a primary OBGYN whose attention is distracted sometimes by having, they have a practice to run. They have their own business to run outside of the hospital. And so they have different requirements in their workday. The OB hospitalist is there and is there 24/7. And so we can work with hospitals to improve quality outcomes, work on protocols or policies, make sure that we're integrated into the care model so that patients are receiving the appropriate care that they need in a timely fashion. So I'll give you one, what I think is a key example. There's a great deal of focus right now on managing patients who have elevated high blood pressure, hypertension in pregnancy, especially severe level ranges. And the goal is really to have those patients assessed and treated really quickly, because we know that if you do that, those patients can have better outcomes, both for them and for their newborn infant. With the OB hospitalist physically being there, you can easily insert them into that care pathway. And without, taking over for a primary physician who might exist in the community, they can be an adjunct to that care and therefore get that patient the treatment she needs in a timely fashion, and keep them, like I like to say, keep them on a safe track for their pregnancy and delivery, and allow the primary obstetrician or midwife to come to the hospital or insert themselves into that care as needed, but without disrupting the care that they may be providing to other patients in the outpatient setting.